Welcome back guys. Now after discussing about the production of the thyroid hormones, now let's see what are the differences between the two important thyroid hormones, that is the T3 and T4. Guys, what do you think? Which hormone is produced more in quantity? Do you think T3 is produced more in quantity or T4 is produced more in quantity? The answer is T4. So T4, it is produced more in quantity. Okay, T4 is produced more in quantity, T3 is produced less in quantity. But which hormone do you think is more active form? Even though T4 is produced in more quantity, T3 is the active form. So T3 is more active, or you can say most potent. T4 is less active. Next, T4 mainly binds with a plasma protein. Which plasma protein? Thyroid binding globulins. So T4 binds with, most of the T4, it is not in the free form. T4 is binding with which plasma protein guys? Thyroid binding globulins. Very important for the exams. If I am talking about T3, T3 also binds with a plasma protein, mainly albumin. Okay. So what is the half-life? The T4 half-life is almost 6 to 7 days. You can say almost a week. T3 half-life is 1 day. So you can remember like 1 day and 1 week. And many books says that it's the T4 which gives the negative feedback. So which hormone mainly gives the negative feedback for the release of TRH and TSH? The one who gives the main feedback is T4. So T3 can also give the negative feedback, but it's the T4 which gives the main negative feedback. If you have to pick up one answer, that the hormone which is giving the negative feedback, it's the T4. So T4 is the one which gives the negative feedback. Because T4 is the real store, right? T4 is the real store. So whenever there is a need, T4 will be converted into T3. Okay, T4 will be converted to T3. So it is the store who decides the negative feedback. Okay, so T4 who decides the negative feedback. Okay, now have I already taught you that T4 is the inactive form, less active form. So it should be converted into the more active form called as a T3. And this process is called as a peripheral conversion. This process is called as what? Peripheral conversion. The conversion of the inactive T4 into active form is called as a peripheral conversion. And where exactly is this peripheral conversion happening guys? In tissues with the help of enzyme called as a 5' deiodinase. Okay, one example of a 5' deiodinase is a D1. Okay, so D1, or you can say D1 is a type of 5' deiodinase. So this D1 enzyme, D1 is an enzyme, okay, which is called as a 5' deiodinase. So this D1 deiodinase or the 5' deiodinase, what it will do? It will help in the conversion of the T4 into T3. Now, where is this conversion happening? Where is this D1 enzyme present? If you ask me, the D1 enzyme, it is mainly present in liver and kidneys. So you can say this peripheral conversion is mainly happening at the level of liver. Now, okay sir, T3 is produced. What exactly is this T3 doing? So T3 is what kind of hormone? It is a catabolic hormone. So it will cause glycogenolysis, proteolysis, lipolysis, everything lysis. Okay, it's mainly a catabolic hormone. Now, for your exams, the most important point is you can actually inhibit this step. Okay, you can actually inhibit this step called as a peripheral conversion. So there are drugs called as a peripheral conversion inhibitors. What are the drugs? Drugs include propylthiouracil, propranolol. Okay, propylthiouracil and propranolol. These are peripheral conversion inhibitors. How to remember for your exam? Everything P, P, P. Everything P, P, P. Now, where do we use this peripheral conversion inhibitors? In which condition we want to stop this peripheral conversion? If you ask me, see these peripheral conversion inhibitors, especially propranolol. Okay, it's a drug of choice. Okay, it is a drug of choice for the treatment of a condition called as thyroid storm. For the treatment of a condition called as thyroid storm. Now students will start to have a doubt, sir, what exactly is this thyroid storm? Okay, whenever there is a thyroid storm, we will use propranolol as a drug of choice. Of course, you can use the propylthiouracil also. But what exactly is this thyroid storm? See, thyroid storm means sudden increase in, okay, sudden increase in thyroid hormones in the blood. Okay, sudden increase in thyroid hormones in blood. So that condition is called as a thyroid storm. Whenever the thyroid hormones are suddenly increased in the blood, the thyroid hormones can lead to high heart rate, increase in BP, increase the body temperature. So it causes a lot of problem. That is called as a thyroid storm. Now you will be having a doubt, why exactly this thyroid storm occurs, sir? Okay, why exactly is this thyroid storm happening? Why suddenly the thyroid hormones are increasing in the blood? Okay, now let me give you an example. Try to understand, guys. Say, imagine there is a person who is having a tumor in the thyroid gland. Now let's say this patient is presented to my clinic with a tumor in the thyroid gland. He is having a tumor. Okay, there is a nodule. Now this nodule, what, it's active. Okay, first of all it is active, which means it is producing the thyroid hormones. So it is having a lot of T4, because T4 is a more quantity produced, right? T4 is a hormone which is produced in more quantity. So there is a lump or there is a mass. Now he presented to the clinic. Definitely it's not looking good, right? Okay, it's a cosmetic problem. Now the surgeon, okay, surgeon is going to perform the surgery here. Okay, surgeon says, okay, let's perform the surgery and let's remove this tumor. Now during the surgery, okay, while performing the surgery, what happened? While we are removing this tumor, the tumor is, this thyroid tumor is very soft. Thyroid gland is very soft. There is a chance this tumor will rupture. So what exactly is happening is the tumor got ruptured. Now whenever the tumor is ruptured during the surgery, see, intraoperative rupture of this tumor, what will happen? There is release of massive amount of T4 into the blood. So massive amount of T4 released into the blood. Now what will happen to this T4? T4 with the help of D1 deiodinase, okay, is getting converted into the more active form called as a T3. And what this T3 will do? The T3 thyroid hormones are going to act on your heart. So whenever it's acting on the heart, it will increase your heart rate, increases your BP. Okay, heart rate increases, your blood pressure increases, and thyroid hormones, later I will tell you, they are thermogenic hormones. Thyroid hormones increases the basal metabolic rate, increases the number of the sodium potassium pumps, increases more heat production in the body. Okay, so thyroid hormones increases heat. Okay, body temperature, you can say, increase the body temperature. So now all these things are happening during the surgery. If it's happening in a normal person, that's okay. But all these events are happening during the surgery. Now I want you to answer this. Tell me, do you want your patient to go into tachycardia during the surgery? Do you want your patient to have high BP during the surgery? Do you want your patient to have high body temperature during the surgery? No, that's definitely going to be devastating. Okay, definitely it's not good thing. So tell me, as a doctor, okay, this condition is called a thyroid storm. Suddenly what happened? There is a lot of thyroid hormones in the blood, and what these thyroid hormones are doing? The thyroid hormones are causing the thyroid storm. Okay, now as a doctor, what you have to do? You have to use a drug which can inhibit the conversion of T4 into T3. So what you have to use? You have to use certain drugs which can inhibit the conversion of T4 into T3. So what are these drugs? Peripheral conversion inhibitors like propranolol. Okay, propranolol you are going to use. Why propranolol? Propranolol, first of all, it will inhibit this step. So what happened to the T3 levels? Decreases. So less the amount of thyroid hormones. Okay, good. Now the propranolol is also a beta blocker. Okay, being a beta blocker, what it will do? It will decreases your BP. It decreases the heart rate. Okay, so propranolol is considered as a better drug. Okay, it's a drug of choice for the treatment of thyroid storm. Okay, sir, fine. But tell me, it is risky or not? It's a very risky thing. Performing a surgery, see, whenever you perform surgery, the patient may land up in, okay, the patient may land up in thyroid storm, and that is life threatening. So tell me, what a good doctor will do? A good doctor is not going to perform the surgery immediately. Okay, the good doctor should never perform the thyroid surgery immediately. Why? Because whenever you perform the thyroid surgery, there is a chance of thyroid storm. Of course, you know drugs which can stop the thyroid storm like propranolol. But a good doctor always prevents the thyroid storm. Always you have to prevent. Its prevention is always better than cure. So how to prevent this thyroid storm? Now I will ask this patient to go for the surgery after 1 month. So within this 1 month, what I am doing? I am going to give Lugol's iodine. Okay, Lugol's iodine, let's say for 4 weeks. Okay, Lugol's iodine for 4 weeks means 1 month, right? So I am giving high doses of Lugol's iodine for 4 weeks. Now tell me what will happen. If you are infusing the patient, if you are giving the patient with this Lugol's iodine for 4 weeks, have I already taught you? Giving high doses of iodine, what it will do? It will stop the thyroid hormone production. So it will stop the new thyroid hormone production. That is called as Wolff-Chaikoff effect. Wolff-Chaikoff effect. Okay, already I have explained you in the previous videos. Here I have explained. Giving high levels of iodine inhibits the thyroid peroxidase enzyme, inhibits the organification process. So this is called as Wolff-Chaikoff effect. So what is the result in the Wolff-Chaikoff effect? The thyroid hormones actually goes down. So now if you are using this Lugol's iodine for 4 weeks, what will happen? Now the new T3, T4 is not going to get synthesized. And whatever the T4 which is already available here, whatever the T4 which is already available in this nodule, that will be used up gradually within this 1 month. This T4 levels will be gradually used up. So after 1 month, what you will have? You will have a tumor with no T4. You will have a tumor with no to less T4. So you can safely perform the surgery. So what I am trying to say, what is the importance of this Wolff-Chaikoff effect? How it is beneficial for us? Wolff-Chaikoff effect prevents the thyroid storm. Okay. So by giving Lugol's iodine, you can actually prevent the thyroid storm. But if there is thyroid storm, you can use propranolol for treating it. Okay. So there is prophylaxis as well as a treatment. Okay. Done? Chalo. Next, after discussing this, now let's discuss about the effects of the thyroid hormones. Effects of thyroid hormones. Now, tell me guys, thyroid hormones are what kind of hormones? They are catabolic hormones. So everything lysis. So by acting on the liver, it will cause glycogenolysis. Okay. By acting on the muscles, proteins, right? By acting on the muscles, it will cause proteolysis. And by acting on the adipose tissue, that is a fat, it causing lipolysis. Okay, causing lipolysis. So glycogenolysis, proteolysis and lipolysis. So all catabolic. But what about the bone and central nervous system? Okay, what about the bone and central nervous system? See, here the thyroid hormones, especially during the childhood, during the developmental time, thyroid hormones are required for the development of the bones and development of the nervous system. So skeletal development. Okay, skeletal development, that's the bone development as well as the brain development. Okay, now you think logically and tell me, imagine there is a kid, okay, imagine there is a newborn without thyroid hormones. So if the thyroid hormones are not there, do you think his skeleton will grow, ever grow? No. Do you think his brain will ever grow? No. So congenital hypothyroidism means by birth itself, if thyroid hormones are not there, there will be stunted growth, the growth is going to be affected as well as the mental development or the brain development will be affected, leading to mental retardation. There will be stunted growth and mental retardation. So this condition is called as a cretinism, guys. It will come in your pathology. So what exactly is cretinism? Congenital hypothyroidism will affect the bone development as well as the brain development. That condition is called as cretinism. Okay, know it. Next, what about the heart? Just recently I have told you the thyroid hormones, whenever they are acting on the heart, what they will do? They are increasing the heart rate. Okay, they are increasing the heart rate and BP. So how is it happening actually? Thyroid hormones, let's say thyroid hormones, whenever they are acting on the heart, let's say here is the myocardium, this is the heart. Okay, whenever thyroid hormones are acting on the heart, now this myocardium will increases the number of sympathetic receptors, increases the number of the sympathetic receptor. Which is sympathetic receptor? Beta 1 sympathetic receptor. So whenever thyroid hormones are going and acting on the myocardium, the beta 1 sympathetic receptor number will increase. So more the number of receptor, more stimulation. More stimulation means, more sympathetic stimulation means heart rate increases. So remember, thyroid hormones makes the myocardium more sensitive to the circulating catecholamines. Okay, thyroid hormones, what I am saying, thyroid hormones makes the myocardium more sensitive to the epinephrine, norepinephrine. Okay, so thyroid hormones increases beta 1 receptors. By increasing the beta 1 receptors, it increases the heart rate. Done. Next. Look, what is happening throughout the body, what these thyroid hormones are doing throughout the body, means general body cells. Okay, look carefully guys here. T4, I have taught you where the T4 will be converted into the more active form T3. Now what this T3 will do? T3 is going to act on your body cells. Let's say this is one of your body cell. See, this T3, it is a lipid soluble hormone, right? I have told you thyroid hormones and steroids are lipid soluble. So they are crossing the cell membrane. And where this thyroid hormone is coming, eventually the thyroid hormone is coming into the nucleus. It is coming into the nucleus. And once it is coming into the nucleus, the thyroid hormone is going to bind with its receptor. So now tell me, thyroid hormone receptors, where are they present? So this T3 receptor, the thyroid hormone receptor is present in the nucleus. So that's why thyroid hormones have intranuclear receptors. Okay, I gave you the mnemonic sex with T3, T4. Sex hormones like estrogen, vitamin A, vitamin D, and thyroid hormones, they have intranuclear receptors. Okay, now fine. So once it is binding with the receptors, what will happen to the number of the sodium potassium pumps? See, let's say in the beginning there is only one sodium potassium pump. But whenever the thyroid hormones are acting on these cells, the number of the sodium potassium ATPases, the number of the sodium potassium pumps increases. Now what the sodium potassium pumps will do, you know, throws 3 sodium out of the cell, brings 2 potassium into the cell by using ATP. That's why the word pump or ATPase. Now in the presence of thyroid hormones, what exactly is happening? Thyroid hormones increases the number of the sodium potassium pumps. So now tell me guys, if there is only one sodium potassium pump, let's say 1 ATP is getting consumed, for example. So thyroid hormones increases the number of the sodium potassium pumps, and by increasing the number of sodium potassium pumps, more number of ATP is getting consumed. So final statement is thyroid hormones increases the ATP usage. Now in the presence of thyroid hormones, my body cells will use more amount of ATP. So can I say thyroid hormones increases basal metabolic rate? What exactly is basal metabolic rate, guys? Basal metabolic rate means how many number of calories, okay, is required. How many number of calories are required by my body to maintain the homeostasis. For example, let's say for the next 24 hours, in order to maintain the homeostasis in the body, how much energy is required to keep this body alive? How much energy is required? That's called as the basal metabolic rate, to maintain my body temperature, to maintain the pH, to maintain the homeostasis, everything in perfect balance. How much energy is required? Definitely some energy is required. How much energy? That is called as the basal metabolic rate. Let's say as an adult male, I require 3000 kilocalories. In a females, maybe 2700 kilocalories is required. But tell me, in the presence of thyroid hormones, whenever thyroid hormones are there, what these thyroid hormones are doing? Thyroid hormones, by increasing the number of the sodium potassium pumps, increases the basal metabolic rate. Means more ATP breakdown means more calories are using by the cells. So yes, increase the basal metabolic rate by increasing number of sodium potassium pumps. So the sodium potassium pumps are increased everywhere in the body. Okay, the sodium potassium pumps are this basal metabolic rate. This energy expenditure is increased in every part of the body except in certain places. Except in, okay, testis. Except in testis, uterus, lymph nodes, spleen, and anterior pituitary. Anterior pituitary. So these are the places, especially in the reproductive organs, okay, especially in the reproductive organs and lymphoid organs and anterior pituitary. So these are the places where the thyroid hormones are not increasing the number of the sodium potassium pumps at the basal metabolic rate. So with this also we have completed the summary or the actions of the entire thyroid hormones. Again I am repeating, thyroid hormones are catabolic hormones causing glycogenolysis, proteolysis and lipolysis. On brain, it is helping the brain development. On the bone, it's helping the skeletal development. Without thyroid hormones, no brain development and no skeletal development, leading to the stunted growth and mental retardation. That condition is called as cretinism. Next, what is the effect of thyroid hormones on the heart? Increase the heart rate, increase the BP by increasing the number of the beta 1 sympathetic receptors. And what is the action of the thyroid hormones on the entire body tissues? The number of the sodium potassium pumps will be increased. By increasing the number of the sodium potassium pumps, the basal metabolic rate will be increased except in certain tissues. I have gave you the list. Okay. So with this, everything about the thyroid hormones is completed. So hope the video is helpful. See you in the next video.